My HD awareness video this year is to the FDA on behalf of my Huntington's disease community, a community defined by both extraordinary resilience and unimaginable suffering. I'm here to address the unmet need that haunts every HD family. Huntington's disease is fatal, genetic, neurological disease that causes relentless breakdown of nerve cells in the brain. As you should know, our community suffers with cognitive impairment, involuntary movement, physical challenges, and psychiatric behaviors. HD slowly robs my community of every bit of quality of life until death. As you know, there is no cure. There is no disease-modifying therapy. As of 2026, there is not a single FDA-approved treatment that changes the course of Huntington's disease. Not one. But HD is not just a personal tragedy. It is a family disease. Every child affected by a parent has a 50% chance of inheriting it. I have met mothers who are gene positive, caring for their dying parent while fearing for themselves and also fearing for their children. I have spoken to young adults acting as caregivers, knowing the disease may strike them even sooner. Generational trauma unfolds before our eyes. When we surveyed the community, the message was clear. The number one hope was that something, anything, would help slow down the progression of HD. You may ask, what amount of time slowing is meaningful? The answer is any amount of time. Any amount of time gained means parents spending more time with their children, people being able to work longer, drive longer, spend more holidays with their families. And finally, the individual living with Huntington's disease, it delays them from feeling they're becoming a burden on the ones they love the most. The urgency cannot be overstated. For years, there has been no viable HD treatments. The FDA has the ability to provide hope for the first time by utilizing accelerated approval pathways that were specifically created to address devastating, irreversible diseases like Huntington's disease. These regulatory frameworks exist so that families facing fatal illness without alternatives are not denied the chance at one more time, one more memory, and more hope. But then, the FDA reverses course. The agency begins to reconsider the use of natural history data and external control, despite its acceptance for rare and fatal diseases where placebo is unethical. This could mean longer trials. For many, further delays is not just a barrier, it is a death sentence. Every day, every delay is one more day that is lost forever. These are not abstract policy concerns. These are parents, spouses, and children watching their loved one die slowly, irreversibly, while a promising therapy sits in regulatory limbo. I want to be very direct. The FDA previously agreed on accelerated approval pathway for Huntington's disease therapies. The community organized around the agreement. Families participated in clinical trials. They endured brain surgeries, MRIs, some invasive procedures. They contributed to a robust Enroll-HD natural history study with data from over 30,000 individuals. Then the FDA changes its stance. The science did not change. The data did not change. Only the agency's position changed. When a regulatory agency moves the goalpost after families have organized their lives and hope around an agreed framework, it doesn't just then delay the drug. It breaks trust. It stifles pharmaceutical innovation in rare disease. And it sends a devastating message to the families who have given everything for research. The Huntington's disease community is not asking to cut corners. We are not asking for approval without evidence. We understand that accelerated approval comes with continued responsibility and data collection. We are asking for three things. One, honor all previous guidance. Uphold the agreement upon accelerated approval pathway for Huntington's disease therapies, including the use of natural history data and external controls. Two, recognize the urgency. HD is fatal, irreversible, and has no disease-modifying therapies. Exactly why accelerated approval pathways were created. Three, expedite review. Make review of approval Huntington's disease therapies top priority. Every day of delay means someone loses function they will never get back. or they may progress past eligibility for future clinical trials, and they may progress past being able to cross over into an open label extension. I close with these words. A young woman who signed our petition, she said, everyone who did not act with urgency and transparency that sits on the FDA board, I want you to sit in the fact that your delays are not only taking my future away from me, you are senselessly killing me, and you are killing others like me. Real human beings, not stats on your board. FDA, do not allow procedural hesitation to become our death sentence. The HD community has done its part. We have participated in research, contributed data, and organized with urgency. Now we are asking you to do the same.